The following video, based on the University of Maryland ICM head-to-toe physical exam checklist, has been prepared as a training resource. The exam maneuvers will be demonstrated in the sequence shown on your ICM checklist. In practice, the sequence may be varied to provide a smooth process. For the purpose of this video, medical terms will be used. However, with an actual patient, jargon should be avoided. General principles are as follows: interpersonal skills, safety, modesty, and comparison. So number one is interpersonal skills. Demonstrate good interpersonal skills. Introduce yourself, describe your role, ask the patient's name and how they would like to be addressed. Use empathetic, verbal, and body language. Conclude the exam by clearly describing the next steps. Number two is safety. Wash your hands before, during as appropriate, and after the exam. Always be in a position to guard and assist. Also, assume your patient is experiencing pain or discomfort, and ask them to report any discomfort. Number three is modesty. Assume your patient is extremely modest. Always ask for permission before exposing or touching, and practice proper draping techniques. Finally, number four, comparison. Conduct all maneuvers in a manner that allows assessment of results bilaterally. All maneuvers are conducted on the skin and without gloves.
Come in.
Hello, sir.
Hello.
Hi, my name is Ray Alcala. I'm a physical exam teaching associate here at the University of Maryland. And what is your name, sir?
John Luch.
Well, it's very nice to meet you, Mr. Luch.
Nice to meet you.
Excuse me, I'm just going to wash my hands. So, Mr. Luch, I'm just going to wash my hands. So, Mr. Luch, now we're going to begin your physical. I'm going to take your vital signs. I'm going to begin by taking your pulse. And I'm going to check the pulse on the other side. So I'm going to place the blood pressure cuff on your arm. I'm going to place the artery marker at the brachial artery. And I'm going to place the patient's arm at heart level. So I'm now going to move on to inspecting and palpating your scalp. Can I have you tilt your head down? And it is okay if I press on your scalp?
Oh, it's okay.
I'm going to start off with inspection. And then palpation. I'm going to palpate your lymph nodes. I'm going to be using 2 to 3 circular motions with 3 fingers over each node, beginning with the pre-auricular, the posterior auricular, the occipital, the tonsillar, submandibular, submental, posterior cervical, the supraclavicular, and the anterior cervical. I'm going to perform your thyroid exam. So I'm going to observe the thyroid. Can you take a sip of water? And can I have you swallow, please? Okay. Now I'm going to palpate the laryngeal cartilages, finding the thyroid cartilage, the cricoid cartilage, and now the thyroid. Now, Mr. Luch, can I ask you to swallow, please? I'm going to inspect your eyes. Could I have you take your glasses off, please? I'm going to inspect your lids, your cornea, and now your conjunctiva. Is it okay if I pull on your lids?
Yes.
Can you look up, please? And can you look down, please? So now I'm going to test your visual acuity. Can you hold this at a comfortable distance and cover one eye, please? And read the smallest line possible.
6, 3, 9, 2, 5.
Okay, so you're 20/50 in your right eye. Please switch and cover the other eye. And read the smallest line possible.
4, 2, 8, 3, 6, 5.
Okay, so you're 20/40 in your left eye. Now I'm going to check your extraocular movements. So if I can have you look at my finger, and without moving your head, follow my finger just with your eyes. Okay, and now I'm going to test for convergence, so follow my finger in. So if I can have you close your eyes really tightly and don't let me open them. Nice and strong. Cover this eye, please, and look at my nose and tell me how many fingers am I showing you.
1, 2, 2, 1.
Now cover this eye and look at my nose and tell me how many fingers am I showing you.
2, 2, 1, 2.
And now I'm going to dim the lights. And if I can ask you to remove your glasses, please. And so I'm going to have you look at this point on the wall in the distance. And I'm going to shine a light first into your right eye to check the direct response in your right eye. And now I'm going to shine it again, but now checking the consensual response in the left eye. Now I'm going to shine the light into this eye, checking the direct response in the left eye. And now I'm going to do it again, checking the consensual response in the right eye. And again, can you look at this point in the distance? And now I'm going to hold the ophthalmoscope in my right hand. I'm going to place it on my right eye to examine your right eye. And I'm going to look into the back of your eye. Okay, now I'm going to move to your left eye. So I'm going to hold the scope in my left hand, using it on my left eye to examine your left eye. I'm now going to move on to your ear exam. I'm going to start off by inspecting your ears. I'm going to pull back on the pinna, look behind the ear. I'm going to place speculum tip on the otoscope. Now I'm going to look into your ear, pulling on the ear, and I'm going to look inside. The other side. So I'm going to start off by performing the Rinna test. So I'm going to first activate the 512 Hertz tuning fork and place this on your mastoid bone. And can you tell me, do you hear the sound?
Yes.
Tell me when you stop hearing the sound.
It stopped.
And you hear the sound?
Yes.
Okay, I'm going to do the same on the other side. Activate the tuning fork and place it on the mastoid bone. Do you hear the sound?
Yes, I do.
Tell me when you stop hearing it.
It stopped.
And you hear the sound?
Yes.
Okay. So now I'm going to move on to the Weber test. So I'm going to activate the tuning fork and place this in the midline on your head and ask you, do you hear the sound equally on both sides, or is it louder on one side?
Equal.
Okay. So now I'm going to move on to your auditory acuity. So can I have you close your eyes, and can you tell me in which ear do you hear the sound?
My right ear. Left.
Okay, and you can open your eyes. I'm going to check the openness of your nasal passages to check for patency. Can you cover one nostril, please, and sniff through the other? And switch, cover this nostril, and sniff through the other. I'm going to take the otoscope and place a new speculum tip onto it. And now I'm just going to look into your nose. And next I'm going to palpate your sinuses. First I'm going to palpate firmly your frontal sinuses. And do you have any pain?
No.
And now I'm going to palpate your maxillary sinuses. And do you feel any pain?
No.
So now I'm going to move on to your mouth exam. So I'm going to just take a tongue blade. And a light source. So if I can have you open your mouth, I'm going to start off by looking at the lips. Now I'm going to look at your gums. So all around at the gums. I'm also looking at your tongue. Can you lift the tongue to the roof of your mouth? And now I'm looking at your teeth. And now can you stick out your tongue and breathe through an open mouth? I'm now going to observe the posterior pharynx, say ah please, as well as the elevation of the palate. And now I'm going to check the Stenson's ducts. And now lift the tongue to the roof of your mouth to observe the ducts of the submandibular gland. So if I can have you now stick out your tongue and move it side to side. Okay, very good. I'm going to check your master muscle strength. So I'm going to place my hands first and then ask you to clench your jaw. Okay, good. And you can unclench. And now I'm going to check some facial muscles. So can I have you show all your teeth like this? Okay, very good. Turn your head against my hand this way. Okay. Turn your head against my hand this way. Okay, good. And shrug your shoulders up, and don't let me push them down. So I'm now going to perform your lung exam. I'm going to just start off by looking at your back. Is it okay if I open the back of your gown?
Yes.
I'm going to start off with inspection of the posterior thorax for scars or asymmetry. And next, I'm going to percuss the posterior lung fields bilaterally, symmetrically, and alternately at 3 levels. Okay. Next, I'm going to check your kidneys. I'm going to place my hand at the costovertebral angle, and I'm going to just give you a gentle tap, and can you tell me if this hurts?
No. No.
Okay. Next, I'm going to listen to your lungs. So I'm going to place the stethoscope on your back. And each time you feel the stethoscope, can you take a deep breath in and out through an open mouth? If you feel lightheaded, please let me know. Okay. Deep breath in and out. In and out. And again. 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 And again. In and out. And one more time. I'm now going to inspect your anterior chest. Is it okay if I lower the gown?
Yes.
I'm inspecting the anterior chest for scars or asymmetry. Next, I'm going to percuss the anterior lung fields at 1 level. And now I'm going to auscultate the anterior lung fields also at 1 level. Please take a deep breath in and out through your mouth. And one more time. I'm next going to examine your heart. So I'm going to just raise the table up to 30 degrees. And then I'm going to take the straight and place this over your lap. Now if I can have you, Mr. Luch, lay back on the exam table. I'm going to ask you to look, try and turn your head to the left. And I'm going to shine a pen light to observe for your jugular venous pulsations. And next, I'm going to have to lower the gown over on your left side. So it's okay if we lower this
Yes.
down on the left side. You can lay back. So now that I've exposed the area, I'm now going to observe for the apical impulse. And I'm going to palpate for thrills or pulsations at the aortic area, the pulmonic area, for thrills and heaves at the tricuspid area, and for the location and strength of the apical impulse. And next I'm going to listen to your heart. I'm going to start off by listening with the diaphragm at the aortic position, the pulmonic, the tricuspid, and the mitral. And next I'm going to listen with the bell at the aortic, the pulmonic, tricuspid, and the mitral. Next, I'm going to move on to your carotid pulses. First, I'm going to listen to them. So I'm going to listen with the bell. I'm going to ask you to please hold your breath. Okay, I can breathe. And can you hold your breath again? Okay, and you can breathe. Now I'm going to palpate your carotid pulses, but one at a time. Okay, now I'm going to move on to your femoral pulses. So if I can ask you to please bend this leg out this way. The popliteals will also be done one at a time. Can you bend your knee up? Now just deaden your weight into my hands. Okay. And now can you bend this knee and deaden your weight into my hands? Okay. Now I'm going to move on to dorsalis pedis pulses. And then the posterior tibial pulses. And now I'm going to check for edema on the bone, pressing on the lower tibia for 3 to 5 seconds. Okay, Mr. Luch, can I ask you to just sit up for a moment?
Okay.
While I lower the table to a flat position. If I can have you lay back. I'm going to have to lower this a little lower to uncover your full abdomen. Is it okay if I tuck this in and lower your waistband just a little?
Yes.
Okay. So I'm going to start off with inspection of the abdomen. Next, I'm going to auscultate the abdomen in 4 quadrants. Next, I'm going to percuss the abdomen in 4 quadrants. I'm going to palpate your abdomen in 4 quadrants, first with light pressure. Let me know if you have any pain. And now with deep pressure. I'm going to move on to the examination of the spleen. So if I can have you take a deep breath in and exhale, and inhale one more time. Okay, you can release. Now I'm going to percuss the liver at the mid-clavicular line. Okay. Now next I'm going to palpate the liver. So starting right here, just below where your lower border was that I discovered upon percussion of the liver, I'm going to ask you to take an inhalation and exhale and inhale. Okay. So for range of motion. Range of motion may be done either actively or passively. For this exam, I'm going to perform the lower range of motion passively and the upper range of motion actively, but it may be done in either form. So I'm going to test your hip flexion. So just relax. External rotation, internal rotation. External rotation, internal rotation. Now I'm going to move on to your knees. So I'm going to test flexion, which I did a little bit last time, and then knee extension. And knee flexion, and knee extension. I'm going to move on to inspect your midfoot, your toes, and the plantar surface of your foot, which is the bottom of the foot. Inspecting the midfoot, the toes, and the plantar surface of the foot. So I'm going to test your range of motion at your ankle. So I'm going to dorsiflex the foot and plantar flex. Dorsiflex and plantar flex. Okay, now if I can ask you, Mr. Luch, to please sit up. So can I see both your hands? I'm going to observe and inspect both sides of the hands. Now spread your fingers out like this, palms down, and make a fist. Now I'm going to inspect your wrists and fists of both hands while supinating and pronating the forearms. I'm going to ask you to flex and extend your wrists. And you can put your hands down. I'm going to inspect your elbows, and I'm going to check flexion and extension of your elbows. And I'm going to check your shoulders. Can you bring your arms forward overhead and now back down to your lap? Shoulder flexion. Now I'm going to check shoulder external rotation. Put your hands behind your neck and bring your elbows out behind. And now put your hands behind your back and bring them up as high as possible. I'm going to check range of motion of your cervical spine. Can you put your chin towards your chest and up towards the ceiling? And now can you rotate your head towards this side and towards this side? And can you bring this ear towards this shoulder and this ear towards that shoulder? So Mr. Luch, if I can ask you to please step down. And if you can face, stand over here facing that wall. Please bend your torso to the right and to the left. And bend forward at the waist and try to touch your toes. And stand straight and bend backwards. And stand straight. So Mr. Luch, now I'm going to proceed to the neurologic exam. So if I can ask you to extend both your arms out straight, palms up. And can you close your eyes and keep your arms up? So next I'm going to check some strength testing. So can you put your wrist out like this? And now can you push up against my hand with your wrist? At the wrist. And now you can relax and push up against my hand. Okay. So next I'm going to have you put your arms out like this. And if you can resist me pushing down on your arms. Okay. So next I'm going to have you put your arms like this and resist me pulling your arm out. And resist me pulling your arm out, and resist me pushing it in, and resist me pushing it in. So that is the biceps and triceps strength. So next I'm going to move on to the hip strength. Lift this thigh off the table, and don't let me push it down. Okay, relax. Now lift this leg off the table, and don't let me push it down. Now straighten your leg against my hand. Straighten your leg against my hand, and pull your leg towards the table. and pull your leg towards the table. So Mr. Luch, I'm now going to perform your sensory exam. I'm just going to take a cotton tipped applicator. I'm going to break that in half. And I'm going to demonstrate this is what dull feels like, and this is what sharp feels like. Can you feel the difference?
Yes, I can.
Please close your eyes. Does this feel about the same as this?
Yes.
Does this feel about the same as this?
Yes.
Does this feel about the same as this?
Yes.
Okay, now tell me if this feels sharp or dull.
Dull. Sharp. 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 Dull. Dull.
Does this feel about the same as this?
Yes.
Let me know if this feels sharp or dull.
Sharp. Dull.
Does this feel about the same as this?
Yes.
Let me know if you feel sharp or dull.
Dull. Sharp.
Does this feel about the same as this?
Yes.
Does this feel about the same as this?
Yes.
Does this feel about the same as this?
Yes.
Does this feel about the same as this?
Yes.
Does this feel about the same as this?
Yes.
Does this feel about the same as this?
Yes.
Okay, now tell me if this feels sharp or dull.
Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull.
Please open your eyes, and now I'm going to check your vibratory sense. So I'm going to demonstrate what vibration feels like. So with the 128 hertz tuning fork, I'm going to ask you, do you feel the vibration?
Yes, I do.
Okay, that's what vibration feels like. So close your eyes, please, and tell me, do you feel the vibration?
Yes,
And tell me when it stops.
it stopped.
And do you feel the vibration?
Yes,
And tell me when it stops.
it stopped.
So you can open your eyes, and I'm just going to demonstrate to you position sets.
Okay.
So you can see here, this is, I'm going to hold your toe by the sides, and
Okay.
I'm going to move it either up or down. Can
Okay.
you tell the difference?
Yes.
Okay, so go ahead and close your eyes and tell me if I'm moving your toe up or down.
Up, up, down, down, up,
Okay, I'm going to go to the other foot. So tell me if I'm moving it up or down.
down, up, down, up.
I'm now going to check your reflexes. I'm going to start off by checking your biceps reflex. So you can just go ahead and relax. Now I'm going to check your brachioradialis radialis reflex. And now your triceps reflex. And now I'm going to move on to your patellar reflex. And now down to your Achilles reflex. So just relax your foot. Relax your foot. I'm going to check your plantar reflex for your Babinski sign. This may feel a little uncomfortable. I'm going to run this along the bottom of your foot. Next, I'm going to check your coordination. So if I can ask you to take this index finger and touch it up to your nose, and now reach out and touch my finger. Now touch your nose and touch my finger. Touch your nose and touch my finger. Touch your nose and touch my finger. Okay, now with this index finger, we'll do the same. Touch your nose, and touch my finger. Touch your nose, touch my finger. Touch your nose, finger, nose, finger. Okay, so I'm going to check for something called dysdiadochokinesia. So if you can take this palm, and you're going to flip it back and forth on your thigh rapidly like this. Okay, now with this hand, same thing on that thigh. I'm going to check heel to knee to shin. Can you take this heel, place it on this knee, run it down the front of your shin, and then back up? And now can you take this heel, place it on this knee, run it down the front of your shin, and back up to your knee? I can ask you to please step down. And if I could have you come over here and step with your back close to the wall. And can you place your feet together, your arms down at your sides, and close your eyes. I'm going to observe for 5 to 7 seconds. I'm just going to have you walk towards that wall and turn around and come back.
Okay.
Okay, now if I can have you walk that way on your toes. Okay, and if I can have you come back towards me on your heels, please. Okay, now if you can have you walk heel to toe in that direction like this.
Okay.
Okay, and if I can have you come back over here. So Mr. Luch, please have a seat back on the table. So that completes our exam, and thank you very much for your time.
Thank you.
Now, Luch, you've got to pay attention to Ray, all right? There you go, all right.
I'm going to break it.
My God.
I'm going to get some more. Stop.
In the room.
Time out.